Good afternoon, everyone. Welcome to the State of the School in 2021. For those of you who got on a few minutes early, I hope you had a chance to see some of the people we recognize for their accomplishments in the past year. And if you interact with them, please join with us in congratulating them on their accomplishments. I particularly want to cite Doctors Wendy Court and Carol Rumack for being named distinguished professors of the University of Colorado, a very high honor indeed. Um, so it is 2021. I have been in this job for 5.5 years now, and as such, have given a number of these talks. And as usual, I went back to look at my talk from last year to see what I said we were going to try to accomplish this year. And I have to say, I noticed a couple things. The words coronavirus, COVID, pandemic did not appear in there. So I thought I would start with a couple of slides from last year's talk before moving into the content for this year. So this was one of the closing slides from last year's talk. You can see the goals here, and we will come back to these later in the presentation. But what you don't see in there are things like surge teams, work from home, campus wristbands, vaccination rollout, or my favorite, Zoom, which used to be what I would say to myself, or if I were alone out loud when I hit the accelerator in my car. It's now, I think, for all of us, become one of the most widely used apps of the new year. Okay, let's try that. I showed this slide last year. It's a statement I still agree with, but I think we would all have to say that Bill Gates was wrong about 2020. It was a year of profound change, and I'd like to talk a bit about that now. So I want to hearken you back to the timeline. It seems like we've been in this COVID pandemic forever, but it was just a year ago that the first case was reported outside of China, a year ago today. I gave this talk on, as I mentioned earlier, January 8th, and at that point, the reports had just come out that there was a novel coronavirus that had crossed over to the human population. And I think we all know what has happened since then. This is a screenshot taken from the Johns Hopkins website last night. You can see that the United States shares the unfortunate distinction of being first in the world in the number of cases and first in the world in the number of deaths. And here is the worldwide incidence of cases over the course of the last 12 months. So it has been a time of profound change in our society and in healthcare in particular. I want to say that I'm extraordinarily proud of the way we and our clinical partners have responded to this. We take care of a large volume of patients with COVID, some of the sickest patients with COVID, with excellent outcomes. In addition, given our role as an academic medical center, we had important roles in testing out new therapies for COVID, as well as in the vaccine trials, particularly the Moderna trial on this campus. And our clinical partners have done an outstanding job in rolling out vaccine distribution, in contrast to many of the stories you read about what's happening across the country. Having said all that, there had been great national talk about faculty burnout and work-related stress prior to this pandemic. And certainly the stresses on families with working from home, school at home, economic impact of the pandemic, whether it's because of furloughs or loss of incentive payments or somebody in the household losing their job. has taken an already stressful career path and made it much, much, much more stressful. We have, in some small way, tried to mitigate the impact of COVID on our faculty and staff. We provided access to cares.com to connect to various resources to help get through this time, as well as backup childcare. We extended the tenure clock for all faculty, but I want to emphasize once again that if you or somebody in your department or division or research group is ready for promotion, there is no need to wait an additional period of time before preparing their application. I want to thank Neil Epperson and her colleagues in the Department of Psychiatry for putting together enhanced behavioral support services throughout this time. And a number of departments have done targeted interventions for their department. Having said all this, it is undoubtedly true that this has been an extraordinarily difficult year. So what have we learned during this year? One is, as evidenced by the public health response to COVID in the United States, a cohesive leadership team with a plan and a clear communication plan is important and can make a big difference in our response to these things. I think there's a renewed appreciation for public health infrastructure. A word that, or a phrase that many of us did not devote much thought to before the past year was supply chain. And it turns out that supply chain is really important. Both for personal protective equipment, the delivery of therapeutic medications, and now currently it's in the news around vaccine delivery and deployment. And I think science is important. We have talked about the toll that COVID has taken on the world and on the United States, and we are approaching in the United States a death toll from COVID that equals the death toll that we suffered during World War II, far exceeding any of our armed conflicts since then. But the fact of the matter is, in less than a year, the virus was isolated, sequenced, vaccines were developed, went through phase 1 testing, went through phase 3 clinical trials, and documented incredibly effective efficacy, at least for the 2 RNA vaccines, and are now being deployed all within a 12-month period. And this is unprecedented in the world of science and in the world of health. If we proceeded at a pace equivalent to what happened during the polio epidemic back in the 1950s, we would be 3 years away from vaccine distribution. So as bad as this has been, if it were not for the science, it could have been much, much worse. The other lessons we've learned that I think will stay with us after COVID is that, contrary to what some people like to believe, people do actually work when they work from home. But not all work can be done at home or remotely, but more can than we thought. And I think you will find, not just in medicine and in our environment, but across society, a different approach to office space allocation, job descriptions, and sites of work than was present 18 months ago. We've learned from our students in physical therapy, our anesthesia assistant program, our physician assistant program, and our undergraduate MD program that we can deliver education effectively remotely, whether it be in small groups or lecture formats. But we've also learned that there are still some things that require people to be together and put their hands on patients and be present in person. And then there is the unquantifiable but undeniably real fact that people like interacting with each other in person, whether it's taking care of patients, whether it's teaching, whether it's engaging in research. Although we were able to open our research buildings back up for laboratory-based research in June, I think to a person, the people in those environments feel that it's not the same when they can't interact in the same way with their colleagues. It's one thing to schedule a formal Zoom meeting. It's another thing to bump into somebody and have an off-the-cuff conversation. And another lesson that I hope we take out of COVID is the fact that we can move quickly when we decide to. I'll cite two examples of that, one related to telehealth and one related to clinical trials. Here is our telehealth volume in CU medicine. And I have no doubt that if I had called our team together in January of 2020 and told them that I wanted to get to 40,000 visits a month within 2 months, they would have told me that I was out of my mind. But our team did it. They did it effectively, in part because of the foundation we had laid, as we'll talk about later, with our upper payment limit program related to Medicaid, but scaled up incredibly quickly, faster than people thought was possible. As you can see, after the spring surge, the numbers have dropped back down, but still much, much higher than they were back. And I think telehealth, provided people don't do something unwise about reimbursement policy, telehealth is here to stay. Its exact role remains to be defined, but clearly in some specialties, it is a very effective way of delivering care. The other example I would cite is clinical trials. It's been a source of appropriate discontent among our clinical research faculty that it sometimes takes what seems like an unduly long period of time to get a clinical trial open at one of our hospitals. But at the beginning of this pandemic, when we were rolling out therapeutic trials, we were able to go from being contacted by a trial sponsor to executing a contract to getting IRB approval to implementing a trial in under 10 days. So our challenge as a group and as a school is to preserve some of that nimbleness and speed without having to be in the middle of a crisis. So as I said on our campus-wide COVID meeting the other day when we were talking about the vaccine rollout, there is light at the end of the tunnel, but we're still in the tunnel. Many of you probably follow the inpatient COVID census numbers for the UC health system and across Colorado. And although we have not yet seen a big post-Christmas or New Year's surge, we are at hospitalization levels significantly higher than we were last summer, although lower than we were earlier this fall. So COVID is still with us. I think today there are between 65 and 70 patients in University Hospital on this campus who carry that diagnosis. And it's likely to be with us for a while longer until there's sufficient distribution of the vaccine to achieve meaningful herd immunity. So I thought for the balance of this talk, before I open it up for questions, and I would ask people to put their questions in the chat, and forewarn you that I will not be able to look at the chat until I'm done with the talk itself, that we would take a quick look back and then a look forward. As always, we have the same set of broad goals: developing and maintaining excellent clinical programs, supporting impactful research, continuing to recruit talent at all levels, students, trainees, and faculty, increasing engagement with the community, particularly the 3 zip codes around our campus here in Aurora. And as has been highlighted by the events of the last year, including the differential impact that COVID has had on disadvantaged communities and communities of color, increasing the diversity and inclusiveness of our School of Medicine community as a foundational strategy to addressing healthcare disparities in our society. So we have a lot of work to do, but I thought it reasonable that we should look at what we've accomplished in these areas. So I showed you this Bill Gates quote earlier. I thought it would be interesting to look backwards to see what we have accomplished for a period longer than a year. But I did not pick 10. I picked 5 or 5.5 because that's how long I've been here, and it was easier to get the data for that. So I'm going to start with the most important thing, which is talent. And during my tenure, I've been fortunate to be able to appoint 4 senior associate deans, Brian Smith, Ann Fulbrigge, Shanta Zimmer, and Peter Buttrick, to be important components of the leadership team here in the School of Medicine. Over the same period of time, I've also had the privilege of recruiting and appointing 6 department chairs. Vesna Todorovich in anesthesiology, Neil Epperson in psychiatry, Leslie Berg in immunology and microbiology, Venu Akathoto in physical medicine and rehabilitation, Evelina Berger in orthopedic surgery, and Julia Cooper in biochemistry and molecular genetics. I'm incredibly optimistic about the leadership they bring to the departments, and I think it's a tribute to the trajectory of our campus that we were able to attract this kind of talent to join us here. And in general, that reflects the growth we have had across this campus. You can see that we have grown for faculty who are on our payroll from about 3,000 faculty 5 years ago to almost 4,000 faculty now. We've had about a 30% increase in our basic science faculty, and our affiliates have also added faculty members. This translates to the fact that we have a very large academic community now. In addition to our faculty, we have approaching 1,200 trainees in various residency and fellowship programs. We accept about 55 graduate students a year, which means at any given time we have about 300 graduate students on this campus. So it is a busy and vibrant atmosphere that we all work in. I want to particularly note the fact that our undergraduate MD program has become more and more attractive to applicants from across the nation. We've basically doubled our applicant pool over the last 6 years. This year, as you can see, we closed at 14,100. Many of you may have read about the so-called Fauci effect that are increasing medical school applications across the country. We are up 35% this year. The country as a whole is up 20%. If you look at the 5-year trend, the country as a whole is up about 25 to 30%, and we are up 100%. So our increase in applications has really outpaced that of the national trends. And I want to recognize the work of Jeff Suhu and the team in the admissions office for processing so many applications in a thoughtful manner. As part of our goal in undergraduate medical education has been to increase diversity, and we have, in some senses, succeeded at that goal. In any given year, somewhere between 25 and 30% of our incoming class identifies with one or more groups that are underrepresented in medicine. An important tool for this has been scholarship funding to enhance diversity. And I'm happy to report that thanks to some very generous donors, including this past year, George Doc Lopez, an alumnus of the school, we have been able to substantially increase the funds available for scholarships to promote diversity. We've also had important contributions from the Mile High Medical Society, the CU Medicine Practice, and our Medicaid upper payment limit program, as well as many other generous donors who've contributed to this trend. At the faculty level, we've also striven to increase diversity. You can look at the numbers here. You can see that the number of Hispanic faculty have increased substantially, as have the number of African American faculty. For those of you who are interested in integrating data and harken back to my earlier slide, it is a fair observation that proportionally these numbers have not increased as much as we would like. And that will continue to be an area of focus for us over the upcoming years. I want to note that a few other things have happened in the past 5 years that are notable. There are a number of infrastructure grants on this list that have either been renewed or obtained for the first time. Among them, the CCSG, the Comprehensive Cancer Center Support Grant, was renewed successfully under the leadership of Dan Theodorescu in 2016 and is up for renewal again this year under the leadership of Dr. Richard Schulich. Ron Sokol and his team put in an outstanding competitive renewal for the CTSA awards, scored very highly, and have been very successful in securing additional supplements to support that award. Mark Deutschman and his team, now led by Dr. Josina O'Connell, were successful in renewing our AHRQ-funded Colorado Area Health Education Center. Paul McLean and his team competitively renewed the Nutrition and Obesity Research Grant. And as you may have seen on the lead-in slides to this talk, Lori Sussel and Jane Roosh led a multi-investigator effort to obtain a Diabetes Research Center award, which had not been here for more than a decade. So I want to thank everybody for their hard work on those grants and recognize the important infrastructure support that those awards bring to our campus. You may recall in 2016, we had an intramural research competition and wound up funding 5 projects. I list them here in no particular order, except I will say I put RNA last because they don't have an attractive acronym to go with their name. I don't have the time here to go into the accomplishments of all these programs. Suffice it to say that I think overall this program has had the kind of impact and brought the kind of talent to this campus that was hoped for when we initially opened up that research competition. And we continue to support junior investigators. This is the number of K awards on the campus now. We are now over 90, and we continue to maintain a roster of about 30 training grant awards, primarily T32s, in an increasingly competitive environment and at a time when some institutes are actually phasing out their training grant awards. In all this faculty growth, talent recruitment, infrastructure support, nurturing of young investigators has translated into increasing success in a competitive world of peer-reviewed extramural funding. I want to particularly draw your attention to the federal funding line here. We have increased 50% over the past 5 years, which I would argue is a very impressive accomplishment given the restrictions on federal funding for research. And I want to, at this point in the talk, acknowledge the contributions of both our faculty in engaging with potential donors and grateful patients, and our excellent CU Foundation staff led by Scott Arthur and Jim Hodge, in increasing the number of endowed chairs we have here at the School of Medicine. These are an important mechanism that not only provide financial support for faculty members and discretionary funds, but also are a recognition of their excellence and accomplishments as contributors to our academic environment. And as you can see here, in the School of Medicine, we've added 25 endowed chairs since 2016. Our colleagues at Children's have added an additional 10, and UC Health endowed their first chair in orthopedic surgery 2 years ago. This has translated as part of an overall increase in the total endowment to the School of Medicine. You can see here the number of dollars raised annually by the CU Foundation. And it won't surprise any of you to know that we are putting a lot of pressure on them to continue to perform at this high level. And that's translated to this kind of an increase in our endowment at the School of Medicine. We're very grateful for all their efforts to this. I will acknowledge that this endowment pales in comparison to some other institutions in the United States, but we have made great strides in our philanthropy and have had great partnerships and greatly appreciate the investment with a lot of generous donors in Colorado and across the nation. So I wanted to talk about our growth in clinical activity, and one way to look at this is our payments to CU Medicine over the last 5 years. And you could see that this is a graph that would fit very well with a line with a significant positive slope, such that we've increased roughly 10% per year over the last 5 years, with one glaring exception right here. And this was the impact of the COVID pandemic back in the spring with the shuttering of ambulatory practices, the deferment of elective surgery, people deferring preventive care services. I'm happy to report we're back on the upswing now, but we still have not, for instance, restored cancer screening to where it was pre-pandemic. And I want to acknowledge the impact that this dramatic 25% or so drop in clinical revenues had on our clinical departments across the school, where many people experienced furloughs or decreases in their incentive earnings. One of the other signal accomplishments of the last 5 years has been our Medicaid upper payment limit program. I want to here pause to thank Jane Shoemaker, our former Senior Associate Dean for Finance and Administration, as well as our government relations team, Todd Solomon, Tanya Kelly-Bowery, and Chad Marturano, for their vision and assistance in helping us obtain this program, which is a federally funded program targeted at faculty of public medical schools, so that's us, with the goal of expanding access to specialty care services for Medicaid beneficiaries. And we are now entering our 4th year of this program, and it has been incredibly impactful across this campus. It's greatly expanded access to Colorado Medicaid beneficiaries to our physician practices. Over the last 2 years, 1 out of every 6 patients on Medicaid in the state of Colorado has received care from one of the members of our team. We've funded 80 plus projects, 40% of which are in child health, and another 20% or so are in both child and adult, with the balance being in adult health, on a wide variety of topics that have had significant impact. Included in that is a real emphasis on providing access to rural and frontier areas, and as I mentioned earlier in this talk, promoting telehealth solutions. So if you look at the Medicaid members we served in the last fiscal year, excluding the emergency room, you can see that we took care of patients from every county in the state of Colorado. If you look at telemedicine, the same is true. We have provided telemedicine visits all over the state of Colorado, and roughly 18,000 last year, which is a dramatic increase over the less than 800 the year before. In addition to clinical care delivered via telemedicine directly to patients, we have stood up an e-consult service. I want to thank Dr. Ann Flobrigi for her leadership and participating in the CORE project with the AAMC. We were one of the first academic medical centers to roll this out in pediatric specialties in addition to adult specialties. And our volume of physician-to-physician electronic consultation has steadily increased. and I anticipate we'll continue on this trend over the upcoming year. We've partnered with two of the larger providers of federally qualified health centers in the region, Stride, formerly known as MCPN, and Salud, to provide access to this service for them. And there has been great uptake and positive reviews from the primary care physicians to whom this service has been offered. And I want to say a word now about our engagement with the Aurora community. As many of you know, we have partnered with Salud to establish a new federally qualified health center in this area of Aurora, where a community needs assessment demonstrated that there were 48,000 people, Medicaid beneficiaries, in the 3 zip codes surrounding our campus that do not have access to primary care providers. So in January of this year, just before the pandemic, we opened this new federally qualified health center on Sable and 6th in leased space in partnership with Salud. That is a prelude to a more ambitious project called the Aurora Community Health Commons. Salud has purchased a parcel of land at the corner of Colfax and Airport Boulevard, 27 acres in size. And we have signed a letter of intent to form a joint venture to develop a multifaceted healthcare-oriented campus on there with programs that are determined by lots of feedback from the Aurora community in an extensive set of community engagement activities that Salud headed up as they provided the basis for planning of this facility. We have committed substantial financial resources to this, and that it will be a site for training for general internal medicine and family medicine residencies, as well as other healthcare disciplines in a true model of interdisciplinary care, as well as a site of rotation for our health sciences students from the Anschutz Medical Campus. We're very excited about this, and I want to thank our colleagues at the College of Architecture and Planning downtown who made visioning exercises for the master site plan for this Aurora Community Health Commons, their advanced graduate school project for the fall semester. So at the end of last year's talk, I outlined the goals for 2020, and I think all of us could be forgiven if we said, you know what, we can't be held to those goals because COVID turned the world upside down. But I just want to go through the list again with you. This was goal number 1, and we achieved that, as I just mentioned. Goal number 2 is something we also achieved. So I'm happy to report that a CAR T-cell trial focused on the CD19 ligand in a CAR T vector developed by Terry Fry and his research group, and developed and manufactured at the Gates Center on this campus, has rolled out in clinical trials in adults. 4 patients have been treated so far who've had otherwise refractory B-cell malignancies. And we anticipate enrolling the first pediatric patient in the trial in the next month or 2, once we have final IND approval from the FDA. With our partners at UC Health, it was a big year to stand up and activate the hospital in Broomfield, the ambulatory center in Cherry Creek, and the hospital at Highlands Ranch. And although they had the same pause, those facilities had a similar pause during COVID, as I showed you earlier, they are back on track to becoming successful clinical sites. I'm going to show you some pictures in a minute, but one of the things that continued unabated over the past year was the construction of the Anschutz Health Sciences Building. There was a commitment to start to build a data science program, and I'm going to spend a couple slides talking about that momentarily. And I would say We have largely completed this, but not, as I'm sure Shanta Zimmer would be the first to tell you, not entirely finished yet with the new curriculum. But that whole curricular development team has done a tremendous amount of work under trying circumstances over the past year. And we are on track to roll out our new medical school curriculum and open our branch campus in Fort Collins in collaboration with Colorado State with the incoming class of 2025. This will always be on our list, continue to recruit talent. So here is some pictures of the Anschutz Health Science Building under construction. This is the southeast facing view of the elevation there with the main lobby under here. And this is the view inside from the atrium. We are still on track to have that building completed and turned over to us in August of this year. We anticipate it will take about 2 months to move everybody in, which would put full or near full occupancy of the building in late October or early November of this year. Included in the programming for this will be our behavioral health programs, the Johnson Depression Center, the Department of Psychiatry, the National Mental Health Innovation Institute, a clinical research center associated with the CTSA, our Colorado Center for Personalized Medicine, our new data science programs, and a number of other programs. So it's a very exciting development for the campus. So I want to talk for a minute about data science and informatics. I think it's a widely held and I think accurate belief by many on this campus that this is a foundational competency that we will need to be to continue our evolution as an outstanding academic medical center. And it's something that we have embarked on strengthening over the past year. I first want to recognize the Colorado Center for Personalized Medicine. It's not a new program. I think it's in year 6 now, or maybe year 7, under the leadership of Dr. Kathleen Barnes. But early on, when diagnostic testing for COVID was a real issue and testing reagents were in short supply and equipment was breaking down, the entire team in the CCPM stepped up and stood up an accurate and high throughput PCR assay for COVID using their Fisher platform. And it's been a very important component of expanding the testing capability on this campus and required a lot of work and a lot of long hours by that team. And I want to recognize them for the important role they've helped play in our response to that pandemic. While all that was going on, they continued to enroll people in their registry. The number of people consented now is greater than 187,000, and roughly 40% of those people have been genotyped so far in a CLIA certified genotyping lab. And the first pharmacogenomic clinical applications of that have been rolled out over the last 2 years and have the potential to really have an impact on decision-making at the point of care while patients are getting care. A major landmark for that center this year was a major agreement with Regeneron. Included in that agreement is a commitment from Regeneron to do whole exome sequencing on 450,000 participants in the CCPM registry and returning that whole exome data to the CCPM and this campus for both research work in correlation with the health data warehouse at Compass. With the retirement of Michael Kahn at Compass, we were able to recruit Ian Brooks, who's provided excellent leadership, and that continues to be a growingly important resource for researchers on this campus. 2 new recruitments this year. One, Casey Green from the University of Pennsylvania, who's going to lead the Center for Health Artificial Intelligence. Dr. Green officially joined us in November and physically moved here a few weeks ago. I think he's going to be an outstanding addition to the campus. And coincident with his recruitment, Sean Davis, who is going to lead informatics for our cancer center here on the campus. Dr. Davis, who trained as a pediatric hematologist oncologist, joins us from the National Cancer Institute. So in closing, I want to talk about plans for the upcoming year. First and foremost, try to get everybody vaccinated. That, of course, is going to depend on supply. And it's also going to depend on our role in helping people who have vaccine hesitancy overcome that hesitancy and make the decision to get vaccinated. We have a number of vulnerable communities who have been hit very hard by the COVID pandemic, among them the Hispanic and African American communities, and have to work to rebuild trust with those communities to help them understand the benefits of vaccination and the fact that it is not an experimental therapy. We're going to continue to build informatics and data science, and I've made the commitment to our informatics faculty that we will establish a new department devoted to data science on or before July 1st of 2022. We received important internal and external feedback that that's viewed as a foundational structural element in order to attract the top talent in the world of informatics. Our new building will open in August, as I mentioned. In that will be 29,000 square feet of additional vivarium facilities that will be connected via underground tunnel to the facility under RC2 and in turn under RC1. This will include a number of procedure rooms and other facilities that will hopefully make it easier for people to conduct animal-based research and address what I viewed as one of the rate limiting aspects of our basic research infrastructure. We're going to continue with our plans to develop the Aurora Community Health Commons. It's an exciting opportunity. There's a lot of work to do, so this will take several years. So you will see this on next year's list of to-do. But I'm excited about the opportunity, and I want to recognize large numbers of people on this campus who've been heavily engaged in moving this project forward. Big news on the education front is the rollout of the new curriculum called the TREC curriculum that will debut with the incoming class of 2025 this summer. It will mark a total commitment to the longitudinal integrated curricular model for the clinical experiences for our students. And I think a very novel and exciting approach to the third year, which will replace some of the previous elective time with a deeper dive into selected topics in medicine. We have a number of chair recruitments underway, and I anticipate, based on conversations I've had with current department chairs, that we will initiate at least 2 more in the upcoming 12 months. So we will be out actively recruiting new talent. Another important development in the area of research is the graduate school. We have about 13 PhD programs that are largely, but not exclusively, led by members of the School of Medicine that are focused on biomedical topics. It's become increasingly evident to various constituents associated with those graduate programs that there would be some advantages to quote local control unquote. So we are recapitulating a model that existed before the graduate school was established here 15 years ago, and that is moving the supervision and administration of those PhD programs back into the School of Medicine. That will involve creating a new position, an Associate Dean for Graduate Studies, and we anticipate posting that job description in the next 2 weeks. and then soliciting applications and beginning the interview process for that. Concomitant with this decision is a commitment to increase the number of graduate students. We won't get there all at once. We're going to do it incrementally over several years, but the goal is to go from the current 50 to 55 students a year to about 75 students a year. And we have an internal/external committee led by Peter Buttrick that is going to provide some advice and counsel about how to distribute that increased number of graduate student slots across our PhD programs. We also, in partnership with the Chancellor, have decided that the time has come for us to better organize and formalize our efforts around health equity. So we are going to be funding and forming a Center for Health Equity and soliciting a leader for that program. We have made the decision that that will physically be located on the Aurora Community Health Commons once that is built out. And it is our hope that this will be a catalyst for helping us to do what we all want to do, which is to erase disparities in healthcare in our community and across our country. And with that, I want to thank you for your attention and close the talk. I close by again reiterating something that you all know. This has been an extraordinary year. It's been stressful on many fronts. Lisa and I are past that point in our lives where we have young children at home, but I know that many of you have school-age children at home, two career couples, and trying to make all that work over the past 12 months and at the same time being asked to step up and do more clinically, it has been an enormous stress. And I think we and the entire community are deeply grateful for your commitment. And I want to thank you for all of your hard work over the past year. And with that, I will open up the chat window and see if anybody has any questions that I can answer. Okay, Q&A, here we go. Okay, so from Dr. Taylor Kessler, also come out of the comparative academic rank and the number in leadership. I don't have the exact numbers at my fingertips. I can tell you that with respect to gender, we have closed the gaps at the associate professor and the professor level over the last 5 years. And I'm remiss in not including that slide in the presentation. So substantially more women have been promoted to the rank of associate professor and professor than men have over the past 5 years. We have, as you saw on the earlier slides, 2 of the 4 senior associate deans in the School of Medicine are women, and we currently have 9 of the 23 department chairs that are women. If you look at communities of color, whether that be Hispanic or African American, they are undoubtedly underrepresented in our leadership numbers. A number of them have stepped up to accept roles in their departments as vice chairs for equity, diversity, and inclusion. A year ago, we had 6 departments with such positions. Now we have 15. But we clearly, as I outlined in the faculty numbers, need to continue our efforts to recruit and advance the careers of people who come from backgrounds that are underrepresented in medicine. Okay, the next question is, will the Aurora Commons Health Center include behavioral health initiatives or mental health care? And that is one I can answer easily. Yes. We and salute our believers in integrating mental health care into the primary care model, and that will be the model on that campus. A question from Chip Dodd about the new CU Research Imaging Center, and I'm going to take that offline, but let the audience know here that we have in Biosciences 3 established a new human research imaging center that has a state-of-the-art PET MRI and a PET CT scan, and will be available to the research community. We are still working on the administration and infrastructure of that program. Dr. Zeffeler asked about the pediatric chief scientific officer. So we have an important activity going on with our colleagues at Children's Hospital about reorganizing and reinvesting in our child health research enterprise. As part of that is identifying a chief scientific officer focused on child health. Without breaking confidentiality, I could say we are fairly far along in discussions with a preferred finalist who's highly qualified, and hopefully it won't be too long before I can provide a name and a start date for that person. An anonymous attendee, will the School of Medicine be vaccinating research faculty and staff who interact with human participants? So we have applied as a campus to be a vaccine administration site, but we have not been allocated any vaccine yet. So the school or the university itself can't vaccinate anybody. I want to very publicly thank our partners at Children's and UC Health for their inclusion of many of our faculty in the vaccination programs and many of our health sciences students. So almost all of our health sciences students now have invitations to and can schedule appointments to be vaccinated. We are in active discussions with those partners about non-faculty or research staff who interact with patients and are advocating for them. But people need to realize that the administration guidelines are dictated by the state of Colorado, and they were recently revised such that hospital systems are not supposed to be vaccinating community-based clinicians. We're trying to clarify whether that includes our PRA staff as well. A related question, will everyone at the university be vaccinated, and will this change any way the travel restrictions established because of COVID? My answer to both questions is I hope so, but I think it's too early to say. If you look at the vaccine acceptance rates at UC Health to date among employees and faculty and staff, of the people who've been invited to be vaccinated, 70% have consented, which means 30% have yet to schedule an appointment. If you go to Denver Health, the numbers are more like 80% yes, 20% not having agreed yet. I think it will depend on the acceptance of the vaccine, the supplies chain, and whether there are adequate supplies to vaccinate everybody. I think once we're at a level where the pandemic appears to be under control, a reasonable number of people are vaccinated, we will certainly revisit the gathering policy, the in-person at work policy, and travel policies. Another comment in here is, I applaud the increasing number of grad students. Thank you. But they are under increased stress of finding positions postdoctoral training. So I would agree. This is an active area of discussion in the literature about what the optimal size of graduate training programs are. We are currently reviewing all of ours with a special focus on the career trajectories of the people who graduate from our PhD programs. I got myself into trouble at a dialogue with the dean earlier this year when I made a flip comment about potential careers after PhD training. I will not repeat that. And we are going to allocate our resources and these graduate training slots to programs that have an established track record of launching people on successful careers in science, whether that be in industry, in education, or as independent researchers. Dr. Hollers asks, are there plans for any additional web bench research building going forward, and if so, in what time frame? Well, the glib answer is no. At the present time, by all the benchmarks, we have an adequate amount of wet bench research space to accommodate our current research footprint and a reasonable amount of growth. Second to the vivarium, wet bench research space is the most expensive space a school can build. So I anticipate it will be a number of years, probably until we retire the debt on the existing research buildings, which is 2027 for most of it, before we can have substantive conversations about taking on more debt if and when we need more research buildings at that time. There was a question about returning to standard procedures in terms of hiring. I think we're getting there. We have a critical hire process that we're going through. Concomitant with our desire to return to standard procedures is that the standard procedures are changing. Many of you are aware that the state of Colorado has passed the Equal Pay Act, which has a number of requirements associated with it related to posting all jobs and posting salary ranges for all jobs that our HR department and colleagues are working through. That's going to require a little more work when you want to go post a new job, at least at first. Hopefully for many of these positions that that will translate to a generic set of salary ranges and things like that that can be used time after time. But the first lap around the track, all this stuff has to be created from scratch. There's a question in here about the utilization of cares.com. I don't have that data available, so I would have to ask Carolyn Brownwell, and I will commit to try to get those numbers and put it in one of the Monday newsletters so that that there is we can answer that question effectively. There's a question about participating in the new health equity program, and I think we have some organizational work we can do before we can meaningfully engage those people. There's a question here about non-faculty clinical staff who are not part of UCH or Children's, but are in the School of Medicine. And as I mentioned earlier, that is where the new governor's guidelines have had an impact. So we're trying to work our way through that. So we're trying to get access. And certainly if we get a vaccine allocation to the campus as opposed to the hospitals, we would be able to vaccinate those people. There's a question here about infertility, health insurance benefits. And that's another one I'm going to have to look up and put in the Monday newsletter, because I do not know whether the CU Health Plan plans to add that benefit, although certainly if it's required by law, we would. I will talk to Tony DeCross and his team at the Health and Welfare Trust and get the answer to that question. The last question I see in here is, when will I announce the new chair of medicine? And that will be when I have a new chair of medicine. I hope that will be very soon, but until I've got a signature on a letter, I'm not announcing anything. And I also want to pause, given this question, and reflect on the fact that I think David Schwartz has done an outstanding job of leading the department through the COVID pandemic. It's been, as it has for all departments, a very trying time, and he's done an excellent job of communicating with the department, providing leadership through the pandemic, and also attending on the clinical service himself. And the hour is upon us, and the Q&A seems to be slowing down here. I think I got to everything. To all of you who are remaining in the audience, if there are other topics you want addressed, or things you want to bring attention to the school leadership, you should feel free to email me at any time. I would offer to meet with you. I meet with any faculty member who requests a meeting. These days, those meetings tend to be via Zoom. But I look forward to the day when we can meet directly again. And I want to close again by reiterating my thanks for what I view as an extraordinary performance during an extraordinary year. To rise to the challenge of COVID and still accomplish all the goals we set out for ourselves a year ago, I think is a very impressive accomplishment. And it has nothing to do with me and everything to do with all of you. So I want to thank you for all your efforts, and thank you for your attendance today. Thanks.